Hi, it's Tom here from Running Physio. Today I want to talk to you about an exercise that's really popular in Pilates, which is the clam exercise, and about how it's been really criticised recently. And there's even this phrase, ban the clam, because we think it might aggravate symptoms of gluteal tendinopathy. There has been some great discussions going on social media about this recently, and I thought I'd kind of bring it to you and see what you think about it, see if I can tell both sides of the story, and then let us know in the comments, do you feel this is an exercise that has real value? Do you think it's something we should drop and go as far as actually to ban it to prevent people from using it? Now, if you'd like to learn more about lateral hip pain and gluteal tendinopathy, which can be challenging to treat, do make sure you check out our free webinar series, which I've linked to. Lots of great information there on assessment and treatment of lateral hip pain. So let's give you a little bit of a background on this and the criticisms behind the clam exercise. Now, obviously, all of you will know the clam. It's a side-lying exercise. You tend to do it with the hips slightly flexed, lifting the knees apart into rotation. And there's several concerns with this. Now, because there's a combination of hip flexion and external rotation, we think it's going to be working the glute med and its tendon in a position where it can be compressed, and in doing so might aggravate symptoms. So that's one of the chief concerns when you're working with someone with lateral hip pain, where we know a very common cause of that lateral hip pain is gluteal tendinopathy. Also, there's been quite a few EMG studies that look at which muscles are active during the exercises we use, and they've actually found that the clam exercise isn't usually particularly effective for recruiting glute med. So if it doesn't really recruit glute med effectively and it might aggravate symptoms, you can see why it might be criticised as not a great option. It's also thought perhaps to target glute max more than glute med, and the concern there is glute max, like TFL, attaches to the ITB, and possibly if we're overworking those muscles, that could play a role in aggravating gluteal tendinopathy, although that, again, like many of these things, is somewhat of a debatable point. So I think it's fair to say, yes, there are better exercise options for gluteal tendinopathy, ones that will work the glutes more effectively, that will work the glutes in a position that's usually better tolerated. And I would say for the majority of people, I wouldn't rush to use the clamps. I would look for better options. It's also fair to say that it probably is overused. It's often a go-to exercise for people with hip pain. And I actually think we need to think through a little bit more about our exercise selection, about what's appropriate for each individual, so that we don't have this recipe-based approach where everyone that comes in with a bit of hip pain gets sent away with clams because they're easy to show people and they're easy to do at home. But the big question I have here is with a phrase like ban the clam, is do we really want to preach avoidance of any particular exercise? For me, this feels quite a lot like the messages we used to give out around avoiding flexion for disc problems. And there's a whole load of exercises through the years that we've been told that you shouldn't do. You shouldn't do seated knee extension for patellofemoral pain because it loads the patellofemoral joint. You shouldn't do clams because they load the tendon. You shouldn't flex and lift because it loads the disc. When actually we know really that tissues like to be loaded. So is it about banning activities altogether, or is it more about trying to find the level of that activity that's tolerable for each individual? Also, this message of ban the clam is very kind of medical model. It's very pathoanatomically based. It's saying that we've got to protect these tissues. They can't tolerate compression. They can't be worked in this position. It needs to be avoided. And we know there's a much bigger picture in pain, and particularly in lateral hip pain, we know there's a bigger picture. Now, some fairly recent research has shown that it's actually psychosocial factors that are more associated with severity of symptoms in lateral hip pain than strength, hip abductor strength, for example. And actually, in the LEAP trial, we saw lots of improvements in symptoms in lateral hip pain without significant changes in strength. So is it really all about trying to increase strength? Surely it's a part of it, but the evidence so far suggests it may not be as big a part as perhaps we previously thought. And if there's a lot of fear, a lot of kinesiophobia, which is fear of movement, catastrophizing around pain, telling people to avoid activities isn't really going to be helping that picture. And actually, recent research in Achilles tendinopathy found that one of the subgroups with the worst symptoms, they actually had the least or fairly minimal structural change in the tendon, but they had the highest level of kinesiophobia and catastrophization. So surely in those subgroups, if they're coming to see us and we're telling them to avoid activities because they're going to be potentially harmful for the tendon, we're perhaps making things worse. So I think we really need to think about the message that we're giving out here. And if we choose not to use clams for any reason, how do we communicate that in a way that doesn't preach avoidance? There's also been some interesting research in lateral hip pain, the GLOBE trial, that compared targeted exercises that we might expect to help gluteal tendinopathy with what they called a sham exercise program, and they didn't find a significant difference in outcomes. So again, it challenges this idea that it's all about the specific exercise you use, it's all about the structure, the stress on the tendon. There are much bigger picture here that we do need to be aware of, and how we communicate these messages is going to be really important. So what I would tend to do here is think of the word adapt rather than avoid. How might we adapt an exercise if it's painful to make it more comfortable? So with the clam, for example, we could get them to do it in slightly less hip flexion if it's an exercise they want to do. See if that's a bit more comfortable for them. We could get them to do it with a pillow or two between the legs, so they're not starting from an adducted position if that's a bit more comfortable. We could get them to do it isometrically, perhaps, if that works better for them. And yes, sometimes it's absolutely appropriate to choose a different exercise, that's fine. But if they're finding that exercise is easy for them to do and actually it's effective for them, sometimes it may be worth saying, okay, well, let's work with this and just try and make it a bit more comfortable, a bit more effective for you. Now, on this message of adapt rather than avoid, again, we want to think about the clam and its variations. Now, there's been some interesting research in this. Boren et al. Did an EMG study back in 2011 on 4 different clam variations. Now, our kind of traditional clam, as we'd think of it, in a bit of hip flexion, lifting the knees apart, keeping the feet together, had relatively low EMG activity. They measure it on something called MVIC, maximum voluntary isometric contraction. So it was about 47% for your traditional clam. But one of their clamshell variations, clamshell 2 as they call it, which was focused more on actually keeping the knees together and internally rotating the hip, had 62% of MVIC, so more glute med activation. Now, this might not be your go-to exercise because there's more hip adduction. You might want to vary this and actually keep the knees apart. Now, this is going to be a bit more challenging. They're kind of clamshell 3 in this particular paper. We're internally rotating through the hip. We're keeping the knees apart with the hip in neutral. And this then had 68% of maximal voluntary isometric contraction of glute med. And then their 4th clamshell variation, where we've got a little bit more hip extension involved, again, keeping the hip in a somewhat abducted position, had even more glute med activation, up to 77%. So we can see actually that there's ways we might be able to vary this to reduce hip flexion, to reduce hip adduction, to change the movement pattern slightly, where we're actually going to recruit glute med more. So again, adapt rather than avoid. Is there a way that we can change this exercise to achieve the goals we want to achieve? And again, I think really as much as possible with people, rather than it being about a list of things you can and can't do, which can be quite disabling, it should be more about adapting to see what works with a person and think what their goal is. Now, if they're not really that fussed about doing the clam, if it's not something functional for them, perhaps they're not too fussed about going back into Pilates where those exercises are commonly used, they're not really married to that as an exercise, by all means replace it, no problem. But how we communicate that is important. I might replace it if someone's very irritable and they're not tolerating it very well and we want a low-level exercise. I might replace it with a nice, simple sideline abduction exercise, often getting the person to rest the leg on a pillow or two so they're in a neutral hip position, and trying to make sure that they're not flexed at the hip as they do it, because then you get less glute med activation, and simply getting them to lift the weight of the leg off the pillow a little bit and holding for 10 seconds to get some hip abductor work going there. And that's often really, really well tolerated in these more irritable cases. So yeah, by all means do replace it. But if we're going to do this, I would often say to the patient that we'll try some different exercises that are a bit more comfortable for you, that are going to be easier for you to do at home. I'm not going to go down the route of saying we must avoid this is harmful, this is damaging, this is not very useful for you. So few thoughts for you there. I'd really like to hear your take on it. Is it an exercise that you use? Do you find it helpful? Have you had problems with it? Do you actually support this idea that we should be getting rid of it and throwing it out of our exercise selection toolbox altogether? I'd also like to throw a bit of a question in here with it. When we see people in clinic who are struggling with it, it can lead to a little bit of like a selection bias. We assume that it's a problem for everyone because the majority of the patients we see struggle with it. But what about those thousands and thousands of people in Pilates classes around the world that are doing it without any issues? If we're putting this message out there of ban the clam, and these messages are really being heard, not just by clinical populations, but by patients as well, are we starting to scare people off doing their Pilates or aspects of their Pilates, which are really actually very useful for them? So I think, yes, there are better exercise options available. Often we're going to choose those options, but how we're going to do that involves communicating with the patient and coming up with a positive message in terms of why we might choose something else. If the patient wants to continue it and you think it's helpful for them, by all means do that, but we look to adapt rather than avoid. Can we find a way of doing it that's effective to achieve your goal, perhaps of strengthening glute med, but doesn't aggravate their symptoms afterwards? And if you can, fine. If you can't, by all means select something else and just think about how you communicate that message. Okay, thanks very much everyone for listening. I look forward to hearing your thoughts on this. Please let us know in the replies and the comments, and do check out that webinar series on lateral hip pain. It's a great 3-part series. There's loads in there that I think you'll find helpful, and the link's there for you in the title. Okay, bye for now.